The following segment is sponsored by the National Psoriasis Foundation. Recent data shows that Americans are under overwhelming levels of stress. This is leaving them vulnerable to underlying disease. Leah Howard, the CEO of the National Psoriasis Foundation, is here to tell us about how stress is affecting our health. Welcome, Leah. Thanks for joining us today.
Thank you so much for having me.
Absolutely. I know that all of us are experiencing stress in our day-to-day lives. I want to talk about the relationship between stress and psoriasis. Can you kind of tell us about that?
So psoriasis is a chronic, systemic, immune-mediated disease that's associated with inflammation. There's actually just over 8 million individuals in the United States that live with psoriasis, and we are part of the 125 million worldwide that live with psoriatic disease. Unfortunately, there's no yet known cause for psoriasis, though we do know that genes play a role. There are, though, a number of common triggers that we see, both that cause or contribute to causing the initial onset of disease, as well as a worsening of symptoms once someone already has psoriasis. And one of those is actually stress.
Wow, everyone experiences stress, as we said. So we talked about that being a trigger. What are some signs and symptoms of psoriasis itself?
So psoriasis is going to present a little bit differently from person to person, depending on you and your skin. So if you're someone with fair skin, your psoriasis may present as red or silvery in a raised patch that is flaky. If you're someone with darker skin, you might have a more purple or brown presentation for the disease. And although it can present at any time on anyone of any age, we do see that it most commonly appears on the elbows, knees, and scalp.
Okay, so let's talk about stress management. If someone has been diagnosed with psoriasis, what are some tips on how they can manage that stress?
So I have 5 tips for your viewers. The first is to work with a healthcare professional, both to get the diagnosis of psoriasis and then to find the most appropriate treatment. So they are going to be able to work with you to determine which therapy is most appropriate based on how severe your disease is and what other health characteristics you have. The second tip is to get a good night's sleep. We know that going to bed at the same time every night improves your overall health, and so we encourage you to really prioritize those Z's. The third tip is to eat a healthy diet. One rich in fruits and vegetables, whole grains, and proteins are going to help with your inflammation and then reduce both your overall stress as well as your risks of psoriasis. The fourth tip is to engage in moderate physical activity. Getting up and moving every day will increase your mood and improve your mood. It will also help to reduce your risk of developing comorbidities, those diseases that are associated with psoriasis, things like cardiovascular disease, diabetes, hypertension, and again, mental health. The fifth and final tip that I would offer your viewers is to build and lean on a support system. So a study was done in June which found that 1 in 3 individuals with psoriasis report that they are depressed.
This has been so informative and incredible, and I feel like we could talk about this for so long. You have so many good tips and valuable information. Really quick, where can audience go for more information?
Visit our website at psoriasis.org to learn more. Your solution is waiting.
Incredible. Thank you so much, Leah.
Thank you.